placement is this a good angle? You can see me. Okay, so the first thing I do in sidelying is just give the pelvic bone a hug. So I come on the iliac crest to ischial tuberosity, try to start real light and gradually increase my pressure of my hands coming together. Any pain with that? Okay, then I actually tend to hug ASIS to PSIS. Then I keep my hand on ASIS, hug the ischial tube, push and pull, so a little posterior glide.
I was gonna say, are you rotating too?
Rotating, yep. So any symptoms with this? Feel anything? No, okay. Then what we do is we go around the rim of the iliac crest and gently mobilize into every plane, okay? Because it should move, it should have normal movement. So we'll see, the ASIS has the least amount of movement. So I lock my elbow-ish, push down towards the table, slowly come off, and come around. Come off. You doing okay?
That one I feel more.
I've always hated that top one. And is it just achy under my hand, or do you feel movement elsewhere?
Under your hand.
You're actually moving quite well,
Am I?
which is awesome. Yep. Yeah, it doesn't feel too restricted. This one usually feels good. Is it okay?
Yeah.
Yeah, okay.
I don't think I realized how flared it was.
It kind of should be. The baby needs to be in the pelvic inlet right now. Then I go right behind ASIS and I release all the insertions of all the hip rotators, abductors, everything. Start at the iliac crest and then just come down along the rim. Is it tight? Yeah, of course, of course. So I try to be gentle at first and give myself a full 1 or 2 seconds to get that, my maximum pressure. And so I go from the ledge of the sacrum towards the head of the femur and back. And then I go lower towards the femur and then back. And I really just gently release everything from sacrum out. Is that too much? You can tell me, full permission.
It's not too much, it's just I feel it.
Excuse me. Thank you.
You have allergies?
Oh my gosh. I have not stopped sneezing for the last like 2 years, I feel like.
2 years?
I swear every month I'm like, oh, it's just a really bad month. Times 24 months. Like,
Oh my god.
it's just bad. Right, more attention towards the tailbone, about the same. Less.
Yeah, I feel a release when you do that.
Awesome.
Yeah.
So I can feel the sacrum right, like just medial to where my pads of my fingers are is the sacrum.
That hurts.
That hurts, yep.
Yeah.
So I'm gonna go softer, and I appreciate that feedback. So what I'm gonna do is trace this all the way. That does feel tight. Holy
Even my
guacamole.
earphones.
Yeah, probably. And your ischial tube is like right here. Yeah, most likely. It's a hip rotator.
Yeah.
It's one of them. And then we can do a little cross friction, although that's not always very nice. Or we can just do a sustained. Is that okay? This space is still tender,
It's so tender, but it's not horrible.
not like that one spot.
I have a pretty high tolerance.
So I work up and down a few times, then I typically give another hug to the pelvic bone. Then I'll roll out with my roller that I left on the TFL. So I always go from just below, so wherever the meaty part starts, right? So below your greater trochanter, and I always stop before the knee joint. I don't like to roll over bones. Is that okay? Tight?
Yeah, I mean, it's like typical IT van.
Typical IT van, squirmy and annoying and not fun. And then typically they say like, oh, it's really tight by the hip, I'll just work there, or really tight by the knee.
Right.
Sometimes it's halfway through.
Yeah.
So once I'm in this position, I like to stretch the quad hip flexor. So gently tighten your tummy with your exhale. Try to totally relax your leg. I hug your foot on my hip like I'm holding a baby. First I extend the hip right about there. Okay, and then I bring the heel to the bum right about there. Or you can do more.
Yep.
Okay, right there. So then I support the knee and I say, go ahead and breathe down to that leg and ask it to relax into my hand or surrender down to the table. Beautiful. And so here, once I let this rest, I'll do, sometimes if their scapula was really talking to me in supine, I'll do a little lift. So I'd have you bring your arm back, and I can do my, just your regular scapular distraction. I can release rotator cuff here sometimes, but I'll do external rotation, punches, taps here with the arm, horizontal abduction in this position. I'll test on eval, external, internal, and abduction here. I try not to push too hard if they're very sensitive in their pelvis. And then if I see it's weak and if I have time, I'll do a series. I always hold. I don't know if you guys do that, but I always
Hold here.
Yeah, because
Like
as they go, they're like rolling.
Yeah.
I don't always notice.
Tell them to do this. I say if you feel like you're moving back, this is in the clinic, so like
Right,
I can't always be there.
Yep.
So push
Back into you. Yeah,
Yeah.
absolutely. If they're really strong, I'll put a band. Everyone always needs to fatigue out. I don't care where you are in life. Fatigue out your rotators. So yeah, I do the whole series here.
Okay.
I try to fatigue it. So I find if after I work the bones and the joints, release the muscles, if I stretch and strengthen right there, they feel really good afterwards.
Okay.
So I used to be like nervous about exercising during a concierge visit, like, oh my gosh, every minute is $10, I have to do something with my hands. But then when I explain that and I say, this is awesome if we could give 2 minutes to this because of the benefits and you'll feel better, they're like, sure.
Yeah.
And people love to feel like they burned out a muscle.
Okay.
Like you accomplished something, you did something, and you feel stronger afterwards, like you're check, I don't have to work out right now. So I really find it helpful. Okay, what was your more symptomatic side? The left. Okay, so now take your time. Exhale, tighten. Yep, we're gonna roll to the other side. Take your time. Yep. And if people get stuck here, they often do, I'll offer. Is it okay if I give you a little compression? Okay, but time helps too, like just settle.
I have round ligament pain.
Oh, you do? There's things we can do for that. All right, so I'll do the same on the other side. Sorry, edit that out. Where is your pain? Is it down here? Low in your abdomen? Yeah.
Actually,
Is it?
that, and then I feel, I don't know if that's him or if it's just soreness, but
Okay.
yeah, like, well, my uterus is huge now, so.
My uterus is huge. Compress. Hug. And so sometimes I try to do this posterior shift and there's nowhere to go because they're so posterior. In prone it's easier to get them anterior, but I try to get ischial tube up and like the anterior compartment of your iliac crest down to to offer like some anterior rotation. So I'm gonna release the rim again. Lynn teaches to have the other hand here to kind of guide where you're pushing and how much. And I always find too when I'm training, sensitive there, it's the top. Top is always.
There's so many attachments there.
It's so much going on, yeah.
Yeah.
And when Lynn explained it, like, you're giving that space opportunity to be offloaded.
Yeah.
Like, I never thought about the bone needing help, like the actual bone tissue.
Yeah.
Because we can get bone bruises, you can fracture, like, it's tissue that deserves to be treated. So if compressing it takes the stressors off of it and things aren't pulling from it for just a moment, it really made a lot of sense to me. So same thing, I like to dig all the way around the iliac crest. You let me know if anything stands out to you.
No, where your thumbs were before, that's what. Yeah.
So more at the insertion. Okay. Nice breathing. That's okay. Is this tighter in? This feels tight too. Okay.
I feel my hip hiking.
Okay, so it's kind of trying to come away. That's
Yeah.
good feedback.
Yeah.
So it's a little too, probably too much pressure for it.
Yeah.
See if it's different if I do less pressure.
Okay. Yeah.
Okay. Do you still feel like benefits? Does it still feel like
It feels better.
good?
Yeah.
That's super important. So those are things that I'm trying to see because most patients won't tell me that. They're like, just take it. This is what you hired her for. You need to just grin and bear it. And it's like, no, if you're literally pulling away from me, your body is telling you this is too much.
Yeah.
And we totally want to respect that.
Yeah.
100%. Just let people feel how they feel. And shoot, if they feel better with less pressure, that's easier for us. One of my patients was like, I always think that I'm being petted by a cat when you release my muscles. Great. Such good feedback.
I don't know what she's talking about.
Right? I had a cat in college. It would sit on my tummy and just do exactly this.
Yep.
Like just need me.
Yeah, exactly.
That was lovely. Okay. How about that? Let you pull away a little bit. Is it too much? Oh, you should go pee. Okay. Is it okay if I stretch your quad real quick? Okay, let's do that. Love it.
I get that a lot. That's why I tell them, go to the bathroom first.
Yeah. I know I didn't even offer you my bathroom when you first got here.
No, it's okay. I went before. I knew this would make me want to pee, but
Right? Yeah.
it's been like over an hour, I feel like. And
Good for you. There you go. Is this one any tighter? Doesn't look tighter.
I feel it all the way up.
You
here.
do, yep. Yep.
So I'm definitely using my hip. I feel like I'm using my hip flexor
Yeah.
on that side.
Mm-hmm. Totally. All right, so I'll have you exhale and tighten. Slide your feet towards the edge and gently push your way up. Beautiful. You're so welcome.